Welcome, everyone. Thank you for joining us today. I hope you've all to stay safe, active, and healthy during the challenges presented to all of us by COVID. My name is Carrie Grady-Vincent, and I am the Senior Manager of Scientific and Clinical Programs here at Osteoporosis Canada. I have been a registered dietitian for well over 35 years, working in many diverse roles. Today, I will be your moderator for the webinar Fore, Golfing with Osteoporosis, presented by Caitlin MacArthur and Sarah Emery in partnership with the Collings Stevens Family Foundation. Before we begin, Osteoporosis Canada acknowledges the land that our offices, located in Toronto, are on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. Osteoporosis Canada is the only national organization serving people who have or are at risk for osteoporosis. The organization works to educate, empower, and support individuals and communities in the risk reduction and treatment of osteoporosis. At Osteoporosis Canada, we educate Canadians about bone health, including healthcare professionals and their clients. We are excited about today's presentation as we understand the challenges warm weather activities can bring. We will be providing general information about golfing and bone health. It is not our intention to provide individual advice, and for more information to talk to your family doctor or a bone fit specialist in your area. If you have questions during the webinar, please remember to click the question and answer button on your screen to submit your questions, and we will try to get to as many as we can, time dependent. So without further ado, let's get started. It is my privilege to introduce our two speakers. Dr. Caitlin MacArthur is an assistant professor in the School of Physiotherapy at Dalhousie University. She focuses her research on improving the effectiveness of and access to rehabilitation for people living with chronic health conditions across the continuum of care, particularly home and long-term care. She is a lead instructor of the Continuing Education Bone Fit, hosted by Osteoporosis Canada, which teaches exercise professionals about safe movements, physical activity, exercise for people with osteoporosis. She is also a valued member of Osteoporosis Canada's Scientific Advisory Council. Sarah Emery has worked in the field of physiotherapy and rehabilitation for 42 years. As a bone fit trained therapist and as an individual living with a diagnosis of osteoporosis, Sarah knows well the importance of protecting bones while staying fit. Since joining LifeMark Seniors Wellness in 2001, is advocated for the provision of treatments and exercise programs that always consider the bone health of the individual, and as a physiotherapist works to enhance the functional abilities of individuals as it relates to their completion of activities of daily living, including work, sports, and recreation endeavors. So now I will turn things over to our speakers. Caitlin, do you want to take it away?
Great, thanks so much for the introduction and welcome to this webinar, everybody. I'm really excited to be here with Sarah to talk about this topic. So just to give you an overview of what we're going to talk about, we're going to talk about generally the benefits of exercise for bone health and some general safety tips to consider, and then we'll get into some really specific tips for golf. And at the end, we'll have some time to answer some questions. So when we think about exercise for bone health, we are really trying to prevent fractures. That's the main thing that we want to try to do with exercise. And we can do that in 3 different ways. The first is to prevent falls, and we can do this through improving mobility, improving balance, muscle strength, and alignment or posture. We can also prevent fractures through safe movement. And particularly when we think about safe movement, we think about protecting our spine and preventing those spine fractures from happening. So things like postural alignment and body mechanics, so making sure we're moving in the correct way or in safe ways. Muscular endurance in our spinal extensors, so those are the muscles that hold us upright all day. And we can also stretch muscles that might be preventing us from getting in that nice upright position. And so today we'll talk a lot about the postural alignment and body mechanics component as that relates to golf specifically. And then the last way that we can prevent fractures with exercise is prevention of further bone loss. So exercise may help us prevent further bone loss that might be resulting from age or from the disease process of osteoporosis. So there's several different types of exercise that are recommended if you're living with osteoporosis. And again, this is a really general overview. We're not going to go into specific exercises today, but this just gives you an idea of what you should be doing. So the first two components that you want to focus on are strength training. And this should be done 2 or more days per week. You want to be working fairly hard. So you should only be able to do about 8 to 12 repetitions. So it should feel like you're working. So this would be like an intensity of 5 to 8 on a 0 to 10 scale, where 0 is you're doing nothing and 10 is you're working as hard as you possibly could. And then you really want to work the major muscle groups of the body. So do a really good general strength training program. If you need help setting that up, that's where you really want to get that individualized advice on how to do that. The next thing you want to incorporate is balance training, and this can be really important for preventing falls. And we know that many fractures happen because of falls. So balance training should be done every day for about 15 to 20 minutes. Now, the great thing about balance training, because that might sound like a lot, is you can sneak it into other exercises. So you can do 2 for 1 type exercises. So you can do strength training exercises that also challenge your balance, or aerobic training that also challenges your balance. So like dancing is a really great example of an aerobic exercise that also challenges your balance. Or if you do a strength training exercise and you stand on one foot or what have you while you're doing it, of course, what's appropriate for you, that's one way you could challenge your balance. So ways you can do that, you can progress from standing still exercises. So that would be like, standing on one foot, standing with one foot in front of the other, to more dynamic exercises, which are things like walking, stepping over objects, etc. Again, this is where you should get some really good individualized advice, because you want it to be challenging enough for you, but you also want it to be safe. So making sure that you get that advice on what's going to be best for you, because everybody's different. The other types of exercise, once you've kind of got your strength training down and you've got your balance training down, then you can think about aerobic exercise. And this is exercise that kind of gets your heart rate up. You're maybe sweating a little bit, breathing a little heavier, gets your heart beating. So this would be things like walking, jogging, cycling, those types of things. Now, ideally, you want to do weight-bearing aerobic activities. So those are things where you're putting weight through your body. So things like walking, hiking, dancing, etc. Are ideal. The ones that are not weight bearing are things like swimming or cycling. And so you really want to try to optimize or do as much of the weight bearing aerobic activity as you can. So you want to do this 5 or more days per week for about 30 minutes or more at a time. And you want it to be moderate to vigorous. So how I usually explain that to people is moderate would be if you were doing your exercise, you should still be able to talk to somebody beside you, but you wouldn't be able to sing. And then vigorous is if you were doing your exercise, you would only be able to get a few words out. So you wouldn't be able to speak a full sentence. And again, you really want to get that individualized advice of what's best for you. Now, spine sparing, we're going to go into a lot of detail in a moment about what that means. And Sarah is going to talk a lot about that relative to golf. So it's really about alignment. So I'll say that right now, and we'll jump into more detail in a second. And then back extensor training. So those muscles that I was talking about that hold us upright, those are the ones that we want to work on with back extensor training. And this should also be done daily. Now, this is where you definitely want to get some individualized advice, because everyone starts at a different place and you might have different needs. So you can get some more kind of information about that specifically for you. So if you have osteoporosis, but you haven't had a spinal fracture or a vertebral fracture, you should be able to do daily activities with your proper body mechanics that we're going to talk about. But you may need to modify some of those more high risk activities like golf that we're going to talk about today. So we'll give you some examples of how to do that. If you have to do any sort of heavy lifting for work or what have you, then you want to see a physical or occupational therapist to give you some assessment or education about that specific to what you need to do for work. If you've had a vertebral fracture or spinal fracture, this is where you definitely want to get some individualized advice from a physical or occupational therapist, especially if your balance is off, or you have some postural changes already, or you have pain, then definitely this is where some individualized advice will be very helpful. And in this situation, you may need to restrict some of those activities of daily living that are a bit more intense, I suppose. So like heavy lifting, cleaning gutters, shoveling, etc. And you want to, if you have a spine fracture, you want to avoid sitting or standing for long periods of time because that can increase the forces through your spine, especially sitting. And so you want to intersperse that with 5 to 10 minutes of lying supine. So that's lying on your back. So it would look something like this, lying on your back, on the bed or on the floor if you can. You can support your head so that you're, in a good position, and your knees bent, your feet flat on the floor, and that will be a good resting place for you. Okay, so how do we modify, or what do we need to modify first of all? And then we'll talk about how we can modify it. So the things that you want to modify are repeated or sustained. So that means doing it over and over or holding it for a long period of time. Weighted, that means holding something heavy while you're doing it. End range, so that means going as far as you possibly can. Rapid or forceful, so that means going really fast or really pushing it as hard as you can. Or combined, so now the movements that we want to avoid are flexions, so that means bending forward or slouching. And usually this is, if I could see you on your cameras, that's usually when everybody sits up a little taller. Rotation, so that's twisting. And then side bending, so going sideways, or any combination of the two. So bending forward while also twisting, or bending forward and bending sideways at the same time. And so all of those qualifiers at the beginning apply to all of these. So things like, bending over and touching your toes and staying there for a long period of time, or doing it multiple times over and over. You also just want to think about the cumulative effects of bending forward, flexion, slouching, or rotation. So through your daily life and work. So a lot of activities we do require us to do these motions. So things like picking up pets or things off the ground or children or grandchildren, things like sitting in a car, sitting in a chair, sitting at a desk, things like lifting heavy boxes, etc. So all of those things can add up. So we want to try to do all of those things with good body mechanics. And then the last thing is just making sure to take care and be thoughtful about lowering something heavy from above your head. So if you have to lower something heavy from above your head, first of all, see if you can get somebody else to help you with that, or if you can modify it so you don't need to do that. But if you really need to do it, just make sure you bring it really close to your body. So you bring it nice and close to your chest and then put it down rather than holding it out in front of you and lowering it down that way. So how can you modify them? So we call this spine sparing strategies. So we're going to modify all those activities, and there's a couple different ways we can do it. The first way is called the hip hinge, which we'll talk about in a second, but that's basically just making sure that you bend at your hip rather than through your spine. Stepping to turn, so moving your feet instead of your spine when you have to turn. We just talked about lowering to the floor or lifting something from above your head all the way down. Being slow and controlled and not going as far as you need, or as far as you can go, just going as far as maybe you need to go. Balancing loads on either side of the body. So like in this picture here, instead of carrying one heavy bag on one side, can you split it up into two not so heavy bags on either side? If you do need to bend forward, is there something you could support your trunk on? So could you put your hand out on a table Or could you put your hand out on the trunk of your car, for example, so that you're supporting, you don't have to hold yourself up. And then, as I mentioned, holding that weight close to your body rather than, out front with straight arms or above your head. So this is the hip hinge that I was talking about. This gives you an example of how to do it with a dowel. So basically or like a meter stick would be another example of something you could use, or a broom handle. Basically what we want you to do is bend at your hips rather than through your spine. So the first thing is knowing where your hips are, and your hip joint is actually where your pants crease if you lift one leg up. Or if you're sitting right now listening to this, when you look down where your pants are creased, that's where your hip joint is. So that's where you want to try to make the bend happen, rather than at your waist, which is where we usually put our hands when we put them kind of on our hips. We put them on our waist. That's actually our spine when we bend. So you want to try to bend at your hips. So here's an example of some activities that you can do using the hip hinge, and Sarah will go through some of these specific to golf. So like tying your shoes, or if you need to put your foot up to do that because of hip limitations, then you could definitely do that and put it up on a platform like this. Picking up objects off the floor is another great time to use that hip hinge. So there's lots of different activities, and Sarah will definitely go through specific to golf what that looks like. So how should you interpret what we're talking about today? So some of the activities that we're going to talk about in golf could have a high fracture risk. If it's not something that you do frequently or you know how to do, we're not saying you should start doing it. We're just giving you tips on how to do it safely. So make sure that you are kind of incorporating those tips. If you've never golfed before, you might not have the body awareness or the understand kind of the movements to be able to implement them well. If you're uncertain, definitely make sure you consult with somebody, a physiotherapist who is bone fit trained would be the best, about your individual risk levels, and then you can kind of weigh out the pros and cons of doing your activity. So what is Bone Fit? We keep talking about it. It's an exercise training program for physiotherapists and health professionals on how to work with people who are bone fit, who have osteoporosis. So you can visit the Bone Fit locator map on the website at bonefit.ca. There's a nice map. You can type in your address. You can see who's bone fit trained around you. And they're specially trained to make sure that they give you the best advice on how to be safe. You could also call the number there on the screen, and they can help you connect with somebody in your area. So just in general, what you want to think about with respect to golf, and then we'll go through some specifics, is how do you get your shoes or gear on and off? How are you going to pick up or load your gear into the car, out of the car, onto a golf cart, out of golf cart? All those types of things. And how are you going to get in and out of those more risky positions, like picking up a ball? How are you going to do your swing, which is one of the most risky positions because you're doing, a rapid, repetitive, weighted end range rotation through your spine. So we want to try to make that a bit safer. And then the risk of falling. So making sure that, you have external support if you need it, because many fractures happen because of falls. So we do want to try to prevent those falls going forward as well. Sarah's going to talk a lot about the transitions and a lot about modifying the golf swing to keep it safe. Okay, so I'm going to pass it off to Sarah, and she's going to walk us through a golf game here.
Yeah, so hello everyone. Yes, I golf, and yes, I have osteoporosis. And when I found out I had osteoporosis, the first thing I thought about was golfing, because it's something that I really enjoy to do, and it's something that I wanted to continue to do. But I wanted to continue to do it while minimizing my risk. And as Caitlin just mentioned, all of those things we're supposed to avoid, right? End range, rotation, force, repetitiveness. Golf tends to have all of those in it, right? So how do you do it safely? Well, first of all, you spend the rest of your days and weeks doing spine sparing activities, right? So if I know I've got a golf game hooked up for a Tuesday afternoon or a Saturday or Sunday, I make sure that I'm protecting my spine throughout the week by doing spine sparing activities, so that my spine's not already kind of like at that end of risk and now I'm going to go play a game of golf. In terms of your bag and putting it in and out of the car, hip hinge is your favorite, is your best option, right? So you'll notice I'm trying to keep my spine straight. When I'm using my legs. You notice I took my bag out of the back of my car in increments. I reached forward, pulled it out a little bit, pulled it out a little bit, pulled it out a little bit, so that I don't have the full weight when I'm reaching forward, because Caitlin just talked about you shouldn't be reaching forward with a heavy weight. And you'll notice that I left the golf bag on the floor of my car, right? So I want the weight of the bag, I'm kind of sliding it rather than picking it up and lifting it. And that's, again, taking some of that load off my spine, right? Trying to use that hip hinge technique the whole way, right? And then the next slide is how do you put your golf bag on your cart? And one of the things I would recommend for safety is not to carry your bag, right? So the golf bags, even if they have the double strap over the shoulder like a backpack, it is still a heavy load, right? And we want to, again, it's a spine sparing activity to be able to, put your bag on a cart. And again, the new carts, most of them now are push carts rather than pull carts like they used to be in the old days when I started golfing. So, but again, how do you attach your bag to your cart and protect yourself? Using that hip hinge, again, is the important thing to do. Making sure, even when you're going down to tie that bottom strap onto the front wheel, that you're using a hip hinge method and you're using your legs and keeping that spine straight. Okay, and then it's shoes. So cleats are the old style golf shoe, and now they've come out with new shoes with nibbles or nibs on them, right? And when you think about the golf swing, the cleat specifically is designed so that you don't move. And I'm a right-handed golfer, so I'm thinking about my left hip. My left foot is going to stay stationary, and I'm going to rotate rotate and put a lot of forceful end range on my left hip. By having my golf shoes, the ones I use are the nibs. I don't use the cleats anymore. I'm giving my foot just that little bit of play so that I'm sparing my hip a little bit. And to put those shoes on, I typically sit down on my bumper, or this golf course happens to have some nice low chairs, and I'm able to get into that nice hip hinge position to be able to put on my shoes. Again, thinking about spine sparing before I even take a swing with my club. So then how do you tee it up, right? So the modified golf lunge is basically the movement that we use. So I've got my left hand on my club. I'm right-handed, so I'm using my right hand to put the ball and tee into the ground. Again, I'm using a little bit of a hip hinge, and I'm reaching down to put that tee and ball, on the tee box. So again, thinking about it, how many times do we tee up during a game? Well, if you're playing 9 holes, 9 times. If you're playing 18 holes, 18 times. So again, hip hinge every single time. I'm spine sparing throughout the entire game. All right. And then we look at the swing. And I've seen a lot of questions come across Osteoporosis Canada in the last week, and they basically say, how do I avoid that ultimate rotation that the golf swing typically has? I had to modify my swing because I sustained some vertebral fractures. And during that period of time, I didn't golf at all. I waited till I got medical clearance to be able to golf, that my spine was solid and my fractures were well healed. And then I basically thought about, how can I protect myself? And the 3 o'clock to 9 o'clock rule really works for me. So I am doing what I call a modified swing. I am taking my club back to 3 o'clock if you're facing the clock, and I'm swinging through to 9 o'clock, which is half of a rotation of my body compared to what I used to do when I was younger and didn't have osteoporosis, right? So again, it's training yourself. The best way to do it is take a 7-iron. If you take a 7-iron and just practice that little bit of rotation going from 3 o'clock to 9 o'clock, right? 3 o'clock to 9 o'clock. You're getting a little bit of rotation, but you're not going through the whole way. So that means my leading hip, which is my left hip because I'm a right-handed golfer, is not having forceful rotation on it, right? My spine is slightly rotated, but not totally rotated that you would see in a professional golfer. And I'm sparing my spine in terms of my swing. The nice thing is by doing a 3 o'clock to 9 o'clock swing, or if you're left-handed, 9 o'clock to 3 o'clock swing, I've got rid of my slice because my hands are stopping as they're facing down the fairway, and the ball tends to go down the fairway. So that's working really well, right, for me. So it's something that I had to go to the practice range in order to shorten my swing, shorten it up between that 3 o'clock and 9 o'clock arc in order to protect my spine, but I can still golf, and I'm happy to be able to do that. Right? And then the other thing I had to think about is my hip, right? So if you're facing your computer right now, the right-hand picture has both of my feet facing forward. So that's what we call a closed stance. And then the left-hand picture, you'll see that my left foot is angled out about 30 to 40 degrees. And what I've basically done is I've opened up my stance a little bit. And by opening up my stance, when I take my swing, I am not putting so much torque and force and rotation through my leading hip, which in my case is my left hip because I'm a right-hand golfer. So again, just think about turning your foot just a little bit out, opening that stance just that little bit so that when you finish off your swing, it's protecting your hip a little bit. So that's a closed stance versus an open stance, and that protects that hip a little bit. And then I push my cart. I used to have a pull cart in the old days, and now I push my cart. Make sure that the handle is set for you. All of these carts now have adjustable stroller handles on them. And when you've got it, you got to make sure that you're in a good position. I see some people with the handle too short and they're kind of hunched over while they're pushing, especially uphill, right? Or it's too high and they're hyperextended with their spine. So again, you have to find that position not only for traversing flat terrain on the golf course, but what about downhill? And what about going up those hills that are on the golf course? You just want to make sure that you've got your stroller handle on your golf cart at the right angle for your arm length, and you can just ask your golfing partner, when I'm pushing this, is my spine straight? And it's really good to have somebody else look at you from the side to be able to see whether you're maintaining that position or not. Okay. And then, of course, walking, right? Walking, Caitlin just talked about a whole bunch of ways we can add in weight-bearing exercises and aerobic exercises. And this is why I love golf. Golf allows me to walk, and it allows me to get in a semi-aerobic exercise. Definitely not walking to the point where I can't talk to somebody, but at least I'm weight-bearing through my bones while I'm walking, rather than using a cart. And then how do you get the ball out of the hole once you've putted it in, right? So again, you can go back to that modified golfer's lunge. Again, leaning on, I'm pulling it out with my left hand just because the camera was there, and leaning on my club with my right hand. I've got the lunge happening. I'm keeping my spine straight, or you can do what a lot of my older golfing buddies do now. They basically have a golf ball retriever top on the end of their putter, and they stick the putter end into the hole, and they pull out the golf ball. So a lot of people are doing that. Obviously, that's extremely spine sparing because you don't have to do the modified hinge. I find a lot of people don't like to do the modified hinge, not because of their spine, it's because of the strain on their knees. So older knees don't like to have, like my left knee right there has got a lot of load on it. So a lot of people like the golf ball retriever cap that's on the end of their putter. Okay. And then you finish your game. You're a little bit tired. The game doesn't end just because it's over and you scored a 86. That was my last game. I scored an 86. All right. And basically, you got to get the clubs back into the car, right? So again, I'm using a little bit of a squat, making sure I'm keeping my spine really, really straight, and then I'm reversing it. I'm putting the clubs on my bumper, incrementally putting them back into the car, making sure that I'm keeping as much of a good spine alignment as possible. And those are the things that I do in order to keep golfing with osteoporosis.
Great, so lots of practical tips there. So we have got lots of time to answer your questions. The benefits, but just to kind of wrap up and to summarize what we've said so far, is that the benefits of exercise for bone health are, we want to try to prevent those falls from happening. So that's where your balance training will come in, as well as your strength training. Safe movements, which we've talked pretty much exclusively about, is how to keep your spine safe, as well as your hips safe while you're playing golf, but also throughout your activities of daily living and the rest of your life. And then thinking about the effect on bone loss. So, exercise, especially strength training, will help us prevent further bone loss associated with age and associated with osteoporosis. So resistance and balance training are going to be the most important ones. So once you've got those set up, then you can add in those other components. So make sure that, aside from your golf, which is, a really great way to get out and enjoy the fresh air and get some exercise walking the course, that you do have a balance and resistance training program in place to help support you with doing that golf. And then make sure you're practicing those spine sparing strategies throughout your daily life and activities. Like Sarah said, the rest of your life, you need to think about all the other activities that you're doing. So great, you modified your golf game, but don't forget about the laundry or loading the dishwasher or mowing your lawn, or gardening is a big one for sure, where we tend to bend over a lot and rotate. So thinking about modifying those activities so you're doing them in a safe way as well. Generally, we want to think about our risk for falling and transitions. So sometimes it's not necessarily just the activity that's the problem, so the actual golf swing, but I think Sarah really highlighted all those other components that are really important too. So how do you get your golf clubs out of the car? How do you put them on the ground? How do you walk the course? How do you carry them? All of those types of things. How do you put your shoes on? And then some very specific tips, and really it's thinking about those spine sparing strategies. So can you step to turn instead of twisting? If you have to twist, don't do your full range of motion. So that's where the 3 to 9 is really great, because you're not going through a full range of motion with twisting. You've now limited it. So that will help keep you safer. Getting bags in and out of the car, using that hip hinge, putting on your shoes, tying your shoes, thinking about the types of shoes that you're wearing. So rather than cleats, could you wear the ones with the little nibs on them so you're not getting kind of stuck in the ground and then stuck in that rotation. Modifying the swing, picking up balls. So that's something you might have to do frequently. So if you could either use the putter picker upper, don't think that's what it's called, but that's what I'm going to call it. There we go. Ball retriever. Or could you do like a modified golfer's reach? So you're using your hip hinge to bend forward, and then carrying your clubs. So making sure you're doing all of that in a very safe way. So hopefully we've given you some specific tips, and we had some questions submitted beforehand, so we'll take some time to answer those now. And I've seen some questions come in the Q&A, so we can also answer those.
Yeah, and we wanted to give some time so people could have time to answer questions. So one of the questions we had got in advance was, what's the best warm-up exercises to do before golfing? Well, for me, I think about what are the main muscles that I'm using for golfing? Well, one are my legs. So I'm definitely going to do a calf stretch. And a calf stretch is and I'm going to stand up a little bit so people can see me, but basically doing your modified hinge and leaving one foot behind allows me to stretch my lower leg and do a calf stretch, right? And I can switch legs and do it again, right? But the one that I do to warm up my spine is I take my golf club. And Caitlin showed you a picture of doing a hip hinge with a dowel. And she was talking about using a broomstick. Well, us golfers, we got sticks. They're called golf sticks. So when I'm at the golf course and I just want to remind myself, what it means to hip hinge. So this is one of the exercises I'm doing. I'm doing a hip hinge. I've got the golf club against my spine, against the back of my skull, and at my tailbone, and I'm doing a hip hinge. And my golfing buddies laugh at me, but I basically say, yeah, but I'm warming up and I'm reminding myself basically how to do that hip hinge so I'm protecting myself and not getting into a poor position. And then when I look at rotation, because I only want to go 3 o'clock and 9 o'clock, I put the club against my body, against my chest, and I just work on just a very gentle rotation. I'm not going to end range, but I'm just getting my spine used to that little bit of rotation that I know the 3 o'clock and the 9 o'clock swing will do. And this is what I work on to just stretch a little bit, right? Okay, you notice I'm not doing bending down, touching my toes. I'm not doing side bends. I'm spine sparing while I'm doing these warm-ups, right? And then I warm up my golfing elbow, right? Because we all have a golfer's elbow when we golf. Hopefully we do those stretches to make sure that we're stretching out our forearm, we're stretching out our underarm, we're stretching out our forearm, and we're stretching out our underarm, right? So, those are the ones. So I usually stretch my hamstrings, my heel cord, I do my hip hinge, I do my elbows stretches, and then I do my gentle rotations with the golf club. And the golf club in hand protects me from going too far.
Yeah, and those are really great because they, as you just said, it gives you some feedback having that golf club there.
Yeah.
But it also kind of reminds you of what a hip hinge is, right? So you get to practice that hip hinge before you're going to do it a whole bunch in a row. So that's really great.
I wake up those muscles. I remind those muscles, you're going to be at work today. So
yeah, this is what we're going to do.
This is what we're going to be doing a lot. So yeah, using it. Yeah. Okay.
All right, Carrie. So what other questions do we have there?
Sure. If you come in, one is, should we use the 3-9 modified swing even before or to prevent spinal fracture?
Well, if you've got a diagnosis of osteoporosis, and again, this is where I would make sure that you're talking to your health professional. But if you're, I was golfing and then ended up with vertebral fractures because of something else, But if you have osteoporosis, I'd be talking to your health professional and basically saying, do I need to modify my swing, knowing that I shouldn't be twisting and going to end range repetitive force? And if you think about that as a golfer, I would be modifying my swing if I have osteoporosis.
Here's another one. How do you balance the need for weight bearing to build and protect bone versus spine sparing?
Can you say that one again?
Yeah, sure. How do you balance the need for weight bearing to build, protect bone versus spine sparing?
They go hand in hand. And I'm hoping that person who's recording this can help us get our pictures back on the screen. Sorry for disappearing there. We'll see if we can get ourselves back. But basically, spine sparing and weight bearing are two different things, right? When we're spine sparing, basically what we've done is we're avoiding all of those risk movements. When we're weight bearing through our bones, we're actually building stronger bones in protected positions that are outside of, that fall within the spine sparing. So they're two different things as far as I'm concerned, unless Caitlin wants to add to that.
I would say the same. So I think I see like the example is that we mentioned not to carry your bags, but this seems like it could be helpful. So definitely carrying bags, can help you put load through your bones, but you want to do it in a protected and safe way. So for example, you wouldn't want to carry one heavy bag on one side, because now one side of your body has to work really hard and the other side isn't working as hard. Or you wouldn't want to carry it out in front of you like this, because now your spine has to work really hard to hold you upright, and that puts a lot of force through your spine. So instead, the way that you carry them is you split your load up into two bags and carry one on either side, and that's much safer. So you are weight bearing, but you're doing it in a spine sparing way. So Sarah's right, they are different. Yeah, they're related but different. So you do want to weight bear, but you want to weight bear in safe positions.
So
safe
walk the golf course while pushing your heavy club bag on a cart. So now you're doing a weight bearing activity called walking, but you're doing spine sparing by not carrying your golf clubs.
Great. Here's a woman after my own heart. Would playing 9 holes instead of 18 be considered spine sparing?
Yes, because of the amount of repetition. Obviously, if you're playing 9 holes versus 18, obviously you're spine sparing, and you've got less and less of all of it, right? Depending on your golf score. I mean, if you're scoring a lot in your 9 holes, and you have to think about that too. I actually golf at a women's night, and we've all decided that we're doing 14 holes. 9's not quite enough. 18's too much. We're all getting fatigued, and we've just found that right where the 14th hole is, it's close to the clubhouse. We've decided that the women's night is going to be 14 holes. So, for all of the same reasons that question addresses.
Okay. I think you've addressed this, but I'm going to ask it again. Will you go over swing modifications?
Yeah. Yeah. So basically with the swing, and again, I'm going to stand up and see if you can see me here. All right. So when I'm looking at it, and I'm in my house now, so I'm trying not to hit anything, right? But when I'm looking at, first of all, you got to get in a good stance, right? None of this, right? You don't want to be hunched over. You want to keep that spine straight. So that means you gotta find your hips, right? You gotta find your hips. Your hips are here. If you put your golf club where your crease is in your pants and you hinge over top, then you're basically in a good position, right? So you'll see a lot of pro golfers do that too. They'll put their club right where their crease is in their pants, and then they'll get into position. So now I'm into position, right? And then from there, basically what I'm looking at, again, I'm trying not to hit anything in my house, okay, is there's my 3 o'clock. You see how far I rotated, right? Only to 3 o'clock, right? And then from there, in terms of the back swing, I'm only rotating to 3 o'clock and then 9 o'clock, because I'm a right-handed golfer, right? I've opened up that stance. So again, I'm stopping here. I could go all the way, right? But that's not good for my spine, right? That's not good for my spine. I did it for demonstration going all the way, but when it comes to protecting my spine, that's not good for my spine. So I've modified it. I stop at 3 and I stop at 9.
Okay. Caitlin, did you have anything to add, or you're good?
No, I think that is a good summary, and it really kind of reinforces those spine sparing principles. So you're not going to end range. So that was one of the things we want to modify, is going as far, we call it end range, which is going as far as you possibly can. So instead of going as far as you possibly can, you're going to modify that. So you're decreasing your range of motion with your rotation, so that that is the spine sparing strategy. So yeah, I think that was great.
Okay. I think we're going to have our last question just to wrap things up. And it's, what would you look for to indicate that golfing career is probably over, that it's time to hang up the clubs?
Me being very sad. I think that would be the first thing, me being very sad. And I really had to have a heart-to-heart conversation with my physiotherapist and my osteoporosis doctor, to talk about basically, should I keep golfing, especially when I had vertebral fractures. And they said, at this point in time, stop golfing. And I went to a lot of therapy, a lot of treatment, a lot of core stabilization exercises, a lot of stretching, a lot of pain management. And it took 2 years for me to, and then obviously working on the medical side of things, which everybody who's got osteoporosis has all that medical management that they have to do, and that's fine. I really worked with my team, and then I basically said, okay, am I ready to golf? Can I get back to it? Because I really do love golfing. And they said, spend this season out on the range once a week, and your maximum is 30 minutes. And I went, really? That's all? Again, holding me back, right? But I listened to my professionals, and I was able to slowly build up tolerance and endurance without fracture for golfing again. So on the opposite end of that equation is, should I stop? Well, obviously, if you have a vertebral fracture, I would be having a heart-to-heart conversation with your medical professionals and your health professionals, because golfing is a risky sport. So if you don't have a history of vertebral fractures and you have worsening osteoporosis, again, that's a time to talk to your health professional about your activities of daily living, your recreational pursuits, which may include golfing, and is it time to hang up the clubs? Yeah.
Okay.
I've changed how I golf. I don't do it as frequent, and I have lightened my bag. I've modified my swing. I've modified my shoes, and I start off at the early start of the season with just 9 holes, and I build up to 14. Once in a while, by September, October, I'll do 18, but I've modified my sport to keep going while protecting my bones.
Yeah, and I'll just add to that. I think Sarah did a really good summary, that it really is a personal, individualized decision, right? So you have to weigh out the risks and benefits for yourself, as well as the other things you do in your life. So, are you doing that strength training? Are you doing that core stability, like Sarah mentioned? Are you sparing your spine and your other activities? Are there other risky activities that you're doing? So there are, a lot of different factors. What is your osteoporosis trajectory looking like? Are you losing bone? Are you maintaining bone? Medications, like there's lots of factors that play into bone health and fractures. So I think you have to weigh out all the risks and all the benefits and all the other things in your life to make that decision. And there's lots of people who can help you kind of navigate that decision. Your medical doctor, your osteoporosis doctor, your physiotherapist, your whoever you're seeing, who can help you kind of sort out all those other bits and kind of bring the whole picture together. But it really is an individualized decision.
Yep.
Wow. Well, that was terrific. Thank you. Thank you to both. Thank you to Caitlin and to Sarah for a very informative presentation on golfing and osteoporosis. For more information on osteoporosis, you can visit our website, which is osteoporosis.ca. There you will find our calcium calculator, podcasts. We have a quiz on knowing your risk, and we also have a repository of our past webinars. I would also like to express sincere thanks to our partner, the Collings Stevens Family Foundation. And finally, I want to thank you, our audience, for joining us today. Have a great day, and I hope you will join us again in the near future, and happy golf. Thanks, everyone.
Thank you. Bye.